Welcome to the Oral Health Podcast, where we are bringing you bite-sized discussions with different people about all things oral health. Now today we are carrying on with our interview with series, and we're talking to Lauren, who is a award-winning dental therapist, and she is going to talk to us about what her role entails, why she decided to become a dental therapist, and the best thing about her job today. We had a brilliant conversation, and I really hope that you enjoy. Good morning, Lauren. Thank you for joining me. So, you're a dental therapist. So, I think generally that is one of the lesser known roles in dentistry. People generally know what the dentist is, of course, the dental nurses, hygienists, but people don't necessarily know what a dental therapist is or does. Can you just explain that for us?
So, dental therapists are probably one of the lesser known members of the dental team. They're not in every practice, but essentially what we do, I sometimes describe it as like the advanced nurse practitioners of the dental world. So we're not a dentist, but we do more than your nurse or your hygienist. So as well as doing all of the things that a hygienist can do, so that's sort of engaging with patients, motivating examination, all the sort of things around gum health support and treatment. We also undertake fillings for adults and children. We undertake a lot of kids dentistry. So I do take out children's teeth if needed, fillings for children. We do some sort of like crowns for children. We also, I'm trying to think what else we do that's different. Yeah, so we've got that added little bit of treatment that is sort of would fall under like the category of restorative dentistry capabilities. But a lot of what we do, well, what I do personally in my role is engaging with patients, motivating patients. I take a big role in sort of the assessment and gathering information about patients and preparing them for treatment, really, with if they're having quite complex treatment with dentists. We are also able to provide treatment under sedation with extra training. So I personally do inhalation sedation for adults and children to help them manage their anxiety with treatment. We can provide whitening with extra training as well. And a lot of our role, and I think of dentistry as well, the public and even sort of medical professionals think of you go to the dentist and you get work done. But actually a lot of our role, the same with a lot of medicine now, is on prevention, motivating patients, engaging with patients, finding out what makes them tick. And for me, my main goal is trying to improve patients' overall oral health and their ability to come to the dentist really and cope with that treatment.
Wow, so really you do an awful lot. That's really interesting. So what does an average day look like for you then in your practice? Do you have an average day?
So I don't actually work in a high street practice myself. I work in hospital services. So one day a week I work with head and neck cancer patients. And I also work with referrals for patients who have quite severe gum disease, who have maybe not responded well in practice. So that's one job. And a typical day for that is sort of a mixture of treatment, so providing gum treatment under local anesthetic. Motivation is a huge part of gum health and getting good outcomes. So I do a lot of motivational work, a lot of taking charts, checking people's oral health. And some days, a lot of my appointments can be more like a therapy session for some of our head and neck cancer patients. They've just come out of a very turbulent time. It's about listening to them, what problems they're having, and seeing if we can find ways to support that. I also might have a few fillings thrown in there as well to sort of stabilize people's dental health after they've had a lot of treatment. And yeah, it's letter writing is another part of it, and communicating with other professionals, and also creating and giving documents to patients to help them remember what's been done. So that's how I start my week on a Monday. And then the rest of the week, I work in community dental services. So that's services for patients who can't access mainstream dentistry because they have either a complex health need, mental health problems, learning disabilities, severe anxieties and phobias. And my specific trust, we're consultant led, so we serve adults and children. And that day is really can be very random. So it could be a day of treatment. So I might see children in the morning, doing some sedation, doing some fillings, taking some teeth out. I might also have some hygienist type appointments thrown in there. Appointments where people who are reliant on others for their oral hygiene are coming in, and I'm teaching carers how to support their needs, often with very challenging patients. So creating oral health care plans that they can take back to their establishments. And then other days in that role, I might have an afternoon blocked off where I'm working on a particular project for our service. So I feel very passionately about oral health and improving that, especially for our special care patients. So I've worked to devise a care plan, an oral health care plan that can go back to care homes and be reviewed and be followed. We also have sessions where we might be having meetings and I might be presenting on a project I've done. So I really value my jobs being very mixed. So I'm not that I think there's anything wrong with working in a practice and doing that treatment all the time. That's just not something that appeals to me personally. I like the mixture of my job. So I like the thinking and the doing and the working as a team, with lots of different professionals and lots of different types of patients, really. So it's a real mixed bag, which keeps it interesting.
Well, that's really lovely to hear as well. I'm sure that if there is dental professionals or dental people listening, that they would be really interested and pleased to know that there is a lot more in the field out there than just the standard 9 to 5, Monday to Friday job in a practice. There's a lot more, that you can get involved with that fits your schedule and your work pattern. So yeah, that's really interesting.
Yeah, and I come from a dental nursing background. Prior to that, I was also a mental health nurse. So I come from a background where I'm really interested in communication and motivation and fear and phobia and how we engage with people. And I've been really lucky to be able to use that to my best, really, and find and almost carve out a role for myself using those skills of dental therapy along with my interests. And it's really nice to be valued by your colleagues for that as well. Often, like I said earlier on, we imagine you go to the dentist, you have your treatment, that is what going to the dentist is about. But I really value the bits that are preparing the patient. So working with my pediatric or special care consultants to gather information, to create resources that are going to help our patients and inform their treatment plans, really. So maybe I'm just someone who doesn't like to call the shots personally. I like to be someone who does the work up, but that's the beauty of this profession. You can find where you fit. And yeah, those people, I have colleagues who I trained with who have their own businesses and run their own facial aesthetics businesses or do very high-end cosmetic work in London on Harley Street. But that didn't suit me. But the beauty is that there are those options for people.
Mm-hmm. So talk to me then a little bit about the link between mental and dental health. It's something we're going to be covering a little bit later in Smile Month, but you mentioned there that you were a mental health nurse. So what made you want to jump from working in mental health to then transitioning into the dental field?
Well, I was actually a dental nurse first. And then I really wanted to go to university. It's not particularly inspiring. I really wanted to go to university. I'd always been interested in psychology, and nursing was a way to go there and do that. And I did enjoy my role. I worked in child and adolescent mental health for a long time, specifically in eating disorders. But I realized quite early on into my career that wasn't going to be something that I could sustain long-term personally. So I went back to dentistry. I looked at so many jobs. I wanted to work in an office and have nice nails and wear nice clothes, which is very silly. But everyone pigeonholes you when you've worked in healthcare. They're like, you've worked in healthcare, you must do a healthcare job. They forget about all the transferable skills you have. But I thought my best job I'd ever had, I'd had a lot of jobs by this point, was when I was a dental nurse, and I absolutely loved it. So I went back into a practice, and then I heard about the community dental service, and I thought, oh my gosh, this is like a mixture of my skills, like I can do both together. So I got a job as a nurse there, and it was actually wonderful colleagues there who encouraged me to do my dental therapy training, to take more of a hands-on role and progress in my career. But the qualities and skills I learned through my mental health nursing, and I think through any kind of nursing, dental nursing as well, those people skills are so important and very transferable. And yeah, that it's something I really value and I use every day. And it's really nice when people ask me my opinions on stuff as well.
What's been your experience generally with mental health and dental health, and how those two interact with each other, for lack of a better phrase?
No, I understand what you're asking. It's a very broad question as well, and there's different aspects to it. So like one of the things that first pops into my head is about people's mood. So when I work with patients who suffer with depression or chronic illnesses or anxiety, where they find themselves in those moments in their mind where they can't really look after themselves, the mind will suffer. And then they'll feel quite guilty about that afterwards. And yeah, our smile, our mouth is so important, and it's our main source of, like, our face is our communication source. And if our mouth is not appealing to other people, people can be very aware of that. Then there's the other branch of it where you're looking at things like addictions, where the mouth has really suffered. Maybe people have had alcohol, drug addictions, which has caused dental disease. You've also got that thing about people suffering with dental problems and that effect on your mental health. So if you're constantly in pain from your mouth, that is going to affect your decision making on a day-to-day basis. That's going to affect how you interact with the world. I used to work in a access clinic, so where people are coming in pain, and some of them would be furious, and you'd be like, this isn't fair, you can't treat us aggressively. And then when you take a step back, you're like, they're in pain and they're scared, and this impacts on that. And if people are living with that every day, long term, this has a huge impact. And then there's chronic things with the mouth that are painful. So there's sort of conditions like burning mouth syndrome. A lot of my majority of my patients who've had radiotherapy have some level of dry mouth, which really impacts on their quality of life. And there are, I'm sure people are aware, oral health quality of life measures that they use in research, where they ask people about how their oral health impacts their day-to-day lives. I think if you've got good oral health and you're motivated and you haven't had those problems, it probably doesn't factor up on that level. But if that's something that's happening every day or even regularly, or I thankfully never had toothache, but the people I meet who have, that pain of being in your head all the time is really having a huge impact. But yeah, and I think we also live in a much more image-focused society as well. So then there's the other side of mental health and oral health, which is going down that body dysmorphia, how imagery type thing as well. So like people are getting these smile makeovers, which can, on the one hand, are amazing, and they can give people that confidence boost. I love nothing more than when a patient's really struggled with their appearance and then they get their teeth fixed and their mouth fixed and they can smile again. That's so beautiful. And it's really lovely to be part of something that can help people with that. But then the other side of it is that comparison of, well, my teeth don't look that good, I need more whitening, I need more fillers. And it's like finding that balance in society is going to be quite difficult, and making sure people are appropriately trained to spot signs where, hang on, this patient isn't quite managing well, or I'm a bit more worried about their body image. That's going to be a big challenge, I think, in cosmetic dentistry and general dentistry, really. Yeah. So there's a lot of arms to it, I think.
Yeah, social media can definitely be a help and a hindrance, because they you see lots of people on things like Instagram with, oh, so my teeth don't look as bright as they quote unquote should do. They don't look as bright as this person, so
Yeah.
I should take that on and do what I can to fix it. And that can have quite harmful consequences, both for your mental health and your psyche and for your dental health. And this is a topic that we'll get into a little bit later in the month, but it's great to hear from your experience what that can be like. But you mentioned as well that you help people with head and neck cancer. You help head and neck cancer patients. What's that like? What has that been like for you?
Yeah, I feel like it's a very privileged job to see patients who have gone through things that are really have a huge impact on their lives. I sometimes see my role as less clinical and more of a listening role in that job. Sadly, I don't meet them before their journey, but I think realistically there's probably a lot going on. So the last thing they want is someone telling them about their oral health. But what's really lovely about that job is seeing those patients who come out and are really not very well, understandably. They've had surgery that's affected their face. Some people have treatment which then affects their arm because they use skin grafts as well, and the recovery process is very long. They've often had radiotherapy, which damages the tissues in the mouth while also getting rid of the cancerous cells. And then if they've had chemotherapy as well, they've really gone through a physical and psychological roller coaster, really. And sometimes they come to me and they're not at their best, and that's understandable. And to see them grow and progress and get back the little things in their life, that's really lovely place to be in. I really enjoy that part of my job.
Now, if you think back over your career, is there any patients that jump out at you and that you know that you've made a difference in their life? I know there's probably a lot, so that's probably quite a difficult question, but is there anyone that immediately jumps out where you can look back at their journey and know that you had a positive impact and you really made a difference in their life?
I worked with a girl who was, she's probably about 7 or 8, and she was very, very anxious. She wouldn't let anyone look in her mouth. She'd had a terrible time. She's also one of these children, and there are lots of them who can't cope with like having wobbly teeth, like they just can't cope with that sensation. So they stop brushing their teeth. And we worked together over months, just meeting quite regularly and doing things in little steps. And gradually we were able to she would let me brush her teeth, then she'd let me use my equipment to clean off the plaque that she couldn't manage to clean off, and we'd have a little go of like wobbling the teeth while we were in there to try and get rid of them. And it got towards the pandemic and I couldn't see her anymore, and I was a bit sad because I do like to know what happens at the end. And she came back for an examination with a dentist, and she got in the dentist chair and she did her exam and she was fine. And she came back to see me another time and the wobbly teeth had gone, and she had the most lovely smile and they were super clean and she was brushing them. And it was like, oh yeah, that helped. That really helped. And it's something so simple, but it was just, I really love in my job working with anxious patients and just seeing them. I don't want them to be able to do like amazing things, like they're not going to go for surgery and stuff, but I think being empowered and feeling confident to sit in a dental chair and have an exam with somebody, and also be able for them to go, stop, I don't like this, can you do it this way? That's what I love the most. They're the sort of my ones where I feel like I have made a difference.
And understandably as well, because it must be so empowering to that patient to be able to go, okay, hold on, I'm not comfortable with that, I'm not happy with that. And that must be a really brilliant thing to give them that confidence to be able to do that.
Yeah, I always joke that I don't do a lot of dentistry. I do a much more, I don't do complex dentistry. I help complex patients. That's sort of my niche. Yeah, I know where I fit.
What then would you say is your favourite thing about being a dental therapist? If you had to just pick one thing, what would it be?
It's super cheesy, but it's my patients. Like I love building relationships with patients. I love seeing them through on a journey. I love, Yeah, I do really love that. And yeah, like helping people to feel empowered, basically. I also really, really love grotty mouths. I love when people come in and they've really not been able to manage their oral health. They're not brushing their teeth. They don't know what to do. And I love being able to teach them that and see the difference. And for them to come back and see the difference. Like that's the other part of it as well. Yeah. I couldn't work in clean, tidy, nice dentistry. It would be boring. Yeah.
So now, do you have any advice for anyone that might be either considering a new career in dentistry or is considering retraining or going into dental therapy? If you had any advice, what would it be?
Keep an open mind. Don't just see things on social media and TV and think that's what the job is. Remember that dentistry isn't just doing dentistry, doing that physical aspect. It's about people. And I feel like if you like people, then it's a good career for you. If you're not so keen on people, it's probably not the right one. But yeah, that open-mindedness and knowing that there's more out there and that you can create, if you work hard and you do the extra bits for yourself and you try out lots of different things, you could create a role that works to your skills really and the things that you want to do. So yeah, don't be pigeonholed. Maybe that's it. Don't think you just have to work in a practice 9 to 5, Monday to Friday, and churn it out.
Yeah, I think that's really good advice. And it's like we were saying earlier, I've definitely had my eye opened. I was definitely guilty of just thinking that dentistry is working in a dental practice and doing this and doing that. And it's actually so much more than that. And I think that's something more people need to be aware of.
Yeah, like before the pandemic, I used to go out on epidemiology studies. So me and a nurse, we would go out and do the dental health surveys. So we were going out to nurseries and checking children's teeth and marking down all that. And that will go into bigger research. You can be a teacher, you can be a lecturer, you can get involved with various societies. I'm an ambassador with the British Society of Dental Hygiene and Therapy, and that's given me an experience of working with yourselves, like different stakeholders, getting involved in larger level, like local and national projects. Yeah, and I do think dentistry is a very interesting career. There's all the public health side of it as well, the professionalism side of like engaging with the public. Yeah, it's very easy when you don't work in a profession to think you know what it is. I'm very guilty of it in medicine even, which is close to us. I wouldn't know about that. But there are lots of opportunities and an opportunity to develop a job. You could do a different thing every day if that was what floated your boat.
Yeah, it sounds like it.
Yeah, you really could.
I definitely feel like I've learned a lot from talking to you, Lauren. It's been a fantastic conversation, and I know I'm going away from this having a much more deeper appreciation for what a dental therapist actually does. So thank you so much for spending some time talking to me. It's been brilliant.
Oh, I've enjoyed it too. Thank you.
Well, there you have it. That was Lauren, who was giving us the ins and outs of what it means to be a dental therapist. Thank you, Lauren, for joining us. I had a brilliant time chatting to you. Now, if you want to learn more about National Smile Month on Twitter and Facebook, you can follow us at Smile Month. You can also follow at Oral Health Foundation on Instagram. If you're listening to this as it goes out, then make sure to follow Instagram because we are announcing a brilliant giveaway where you can get your hands on lots of free oral health goodies. You can also visit our website, which is www.smilemonth.org, for lots of brilliant advice. And if you want some more personal advice, you can contact our dental helpline. All of their contact information will be in the description of this podcast. Thanks again, Lauren, and thank you for listening.